And I use cholesterol-lowering medications when appropriate, but there are some people that clearly don't have to have it. And we're going to understand this, and we're going to come back to our biblical prescription as we answer this question: who benefits from a statin? Who needs to take it? A 70-year-old smoker that's had a heart attack and a stent about 4 years ago comes to the office. And we're talking, he's not having any symptoms. And I say, listen, do you want to lower your risk? Of course, I ask him if he wants to quit smoking. He says, no, I don't think I can quit smoking, unfortunately. I said, well, let me check your cholesterol. His cholesterol is way above the recommended level. Would it benefit him from taking a cholesterol medication? Well, I would say yes, as long as he doesn't have a side effect. The most common side effect are muscle aches, liver abnormalities. Some people, it can increase the risk of diabetes, or some people can increase the mental issues, but that's very rare. But I would tell him the risk of heart attack is way up here, and the fact that you smoke even makes it higher. The cholesterol medicine will bring it down a little bit. So cholesterol can help us from getting fat in the artery. In addition, it helps with some inflammation. It makes the plaques that are already there a little bit more stable. So he might benefit. Let's talk about another patient. Let's say I have an 85-year-old with heart disease that's not too bad, and the cholesterol comes back just a little bit high, and she has some mild memory problems. Let's say she eats a pretty good diet and her heart's been stable for years. Well, I would talk to her a little bit and I'd say, listen, for you with the memory problems and you don't have serious disease, let's work on lowering your cholesterol other ways. Remember, we just want to get the cholesterol level down. Statins can help, other cholesterol. So I'd say, well, let's do a walking program. Let's maybe eat a little bit less ice cream at night and cut back on the fatty foods. That would probably be less risk than taking a statin. Now, if you have another event or the risk is even higher, we could reconsider as long as you weren't having a side effect. But I think the memory problems and your mild disease, and let's try these other lifestyle changes, that might be a better way to bring your cholesterol down to a lower level. In fact, the studies have showed that plant-based nutrition and regular exercise can lower the cholesterol dramatically if people are just willing to do it. And I found in my practice that many patients, if they're given alternatives that are less risky, they will do it. We just need to offer it to them. However, so many times the doctor says, well, let me just put you on a medicine, and doesn't spend the time educating them on other ways to lower cholesterol.